It's true, you can be so hot that it can kill you. With climate change, temperatures are rising higher than ever and heat waves are becoming more frequent. On the other hand, outdoor activities can be great for the body and the mind, helping to treat and prevent conditions like heart disease, depression, and anxiety. Prevention is the best form of treatment, but as temperatures continue to rise, more and more of us are still at risk of heat stroke and other heat-related illnesses, but learning more about them can help keep you and your loved ones safe. I'm Zane, a board-certified primary care doctor, and in this video we'll talk about the difference between heat stroke, heat exhaustion, and other heat-related illnesses, how to recognize them, how to treat them, and when to seek medical care. If you haven't already, check out my other video on who's at risk of heat-related illnesses and how to prevent them. All of the illnesses related to heat are caused by hyperthermia, or an abnormally high body temperature. Like a lot of things, the body functions optimally within a certain temperature range, and as cells get hotter, they stop working properly. And this dysfunction worsens as temperatures continue to rise. As that happens, some people might experience heat edema, which is swelling in your ankles and feet when you get hot. People with heat edema can try putting both legs up to reduce swelling, but if that doesn't work pretty quickly, they should check with their doctor. Heat cramps are exactly what they sound like: painful tightening of muscles in the stomach, arms, or legs related to overheating. Cramps can happen after physical exertion and exercise, and if this happens, people should try to find a way to cool down quickly by finding shade or AC, or removing excess clothing and drinking water. Cooling down can also help with heat syncope, which is a sudden dizziness or lightheadedness that can happen when someone's being physically active in hot weather. In addition to cooling down and drinking water, raising the legs up to increase blood flow to the heart can make the dizzy feeling go away. Heat exhaustion is a more serious heat-related illness. It's like a warning sign that the body can't keep itself cool anymore and is a precursor to heat stroke. It can cause dizziness, weakness, nausea, lots of sweating, and more. The person's body temperature might still be normal though, but the skin might feel cold and clammy, and some people might have a fast heart rate or tachycardia. People with heat exhaustion should try to cool down as soon as possible. If we're not careful, heat exhaustion can progress to heat stroke, which is a medical emergency and can be fatal. The way I remember the difference between heat exhaustion and heat stroke is that just like strokes in the brain are extremely dangerous, heat stroke is the most serious heat-related illness. If a person with heat exhaustion doesn't feel better soon, like within an hour, or you suspect that heat stroke is happening to you or someone else, get medical help right away. As body temperatures rise further, cells in the body start to get destroyed more quickly. Temperatures above 104 degrees Fahrenheit are more likely to result in heat stroke, but elevated temperatures are not always necessary to diagnose heat stroke. There are often obvious signs of heat stroke, such as these. Let's go over some of them more in detail. Neurologic abnormalities are often the first noticeable sign of heat stroke because the brain is pretty sensitive to heat. Fainting and losing consciousness are often the first neurological signs of heat stroke, so if someone passes out because of the heat, that is a medical emergency and that person should get medical care right away. Encephalopathy is another neurological sign of heat stroke that's also common. That's when the brain isn't working right, causing neurological or behavioral changes. If this happens, that's also an emergency and requires immediate medical care. People with heat stroke might start feeling confused. People might say they're acting strangely, like agitated, grouchy, or combative, or have bizarre behavior. They might stagger or have trouble walking. Seizures are also possible. In extreme cases, the brain can swell up, which can be deadly. Brain injury happens in up to a fifth of cases of heat stroke. Any of these signs or symptoms are signs of brain dysfunction and are an emergency. If you or someone around you is showing these symptoms, call 911 or get care right away. Depending on the cause of overheating and someone's age, the other signs of heat stroke can vary. In the classic form of heat stroke caused by hot weather or environments, the skin is often dry even if the person feels hot. In the exertional form related to physical activity, profuse sweating and wet skin can happen, but dry skin is also possible. Older adults age 50 and up have the highest risk of heat stroke. They're more likely to have illnesses and conditions like weakness or diseases of the heart, lung, or kidney, which can all make people more sensitive to heat. They're also more likely to be on medications like these, but there are also age-related changes to the skin that make it harder to get rid of excess heat. As we age, circulation isn't as good and sweat glands don't work as well, which increases the risk of heat-related illnesses even further. Infants and young kids can also be more sensitive to heat. If heat stroke continues, it can lead to continued damage that ends in multi-organ failure and possibly death. When it comes to the heart, heat stroke can cause abnormal pulses, both a strong, rapid pulse called tachycardia or a slow, weak pulse called bradycardia. It's also possible to have rapid breathing or low blood pressure. The heart muscle itself can get damaged and even stop beating, and blood vessels and the body's ability to clot can stop working correctly. Muscles can break down, something called rhabdomyolysis, and that's common too. This stuff called myoglobin leaks out of the damaged muscles and gets into the bloodstream, which then gets filtered by the kidneys, where it can cause kidney damage. Rhabdomyolysis can happen with overexertion too, like really long runs and bike rides. The intestines are filled with bacteria that both help us digest food but can also play a role in disease. Inflammation inflammation in the intestines kills the cells of its lining and decreases the strength of its barrier, allowing bacteria and their toxins to leak into the bloodstream where they do damage to the rest of the body. The liver can then get overwhelmed trying to detoxify the body from all the bacteria and their chemicals, which is even harder to do because the liver cells themselves have also been damaged by the heat. When to call 911. Again, if heat-related symptoms don't improve, the person still has a high temperature despite treatment, or you just simply suspect heat stroke, call 911 or seek medical care immediately. To try and keep heat stroke from happening, here are some quick steps people can take at the earliest sign of heat-related illnesses, including heat syncope and heat exhaustion. Step 1. Get out of the heat as quickly as possible and into a shaded and cool place. Air conditioning is best. Take off any tight or extra clothing. If you think the person is having heat stroke, like if they have any of these signs or are too drowsy to drink safely, don't give them fluids. Otherwise, if the person can swallow safely, encourage sips of fluids, but avoid alcohol and caffeine. Water and fruit or vegetable juices are good choices. Step 2. Get blood flowing to the heart by lying down and elevating the legs. Step 3. Actively cool the body down. Cooling someone down quickly and effectively is the cornerstone of treatment for heat stroke and other heat-related illnesses. This can help regulate and lower internal body temperature. Only something as critical as CPR should come before cooling if necessary. Outside of a medical setting, cooling happens by applying cold objects or water to the skin or immersing the person in cool water. Cold objects like wet cloths or ice packs can be applied to the wrists, neck, armpits, and groin. These are places where blood passes close to the surface of the skin, acting like a natural radiator, so these cold objects can help cool the blood. If it's safe to do so, the person can shower, bathe, or sponge off with cool water. If rapid cooling is needed, the overheated person can be immersed directly in cool, not cold water until they show signs of recovery and consistently maintain a temperature under 102 degrees Fahrenheit. These steps can be taken for anyone with a heat-related illness, including people with heat exhaustion or heat stroke while waiting on medical treatment. For older adults with classic heat stroke from hot weather, applying ice packs or wet cloths are less efficient than immersion in cold water, but they're generally better tolerated and are readily accessible and easily applied. Fanning can sometimes help too, but if the temperature isn't too hot or humid. In high temperatures and humidity, the air doesn't have enough capacity left to take the heat away from the body, so cooling with the fan is less effective. In fact, some older adults may get even hotter if only a fan is used to cool them down. We don't have any medicines to bring the body temperature down when it's caused by overheating. Because fevers are caused by biochemical reactions, medicines like TYLENOL can work on them, but TYLENOL cannot help heat stroke and might even make liver damage worse. There are some medicines and herbs that are being studied to see if they can help limit the organ damage caused by heat stroke, but they're still under investigation. As far as returning to activity, people who have had heat stroke and heat exhaustion will be sensitive to heat for days to weeks and should ask their doctor when it's safe to return to normal activities. Heat injury releases a cascade of inflammation that might persist and raise the risk of heat problems for days afterwards, so it's important to rest and recover. Though there might not be comprehensive guidelines for returning to work or other activities, people should use their judgment, take their time, avoid hot weather and exercise, and definitely wait for labs and clinical findings to go back to normal before they go back to normal. As you can see, hyperthermia can wreak havoc on the body, so at the end of the day, preventing heat stroke and other heat-related illnesses is much easier and more effective than treating them. If you're interested on learning about how to do that and who's at higher risk of heat-related illnesses, check out this other video I made. Peace, and see you in the next one.